The first one I want to talk about, and this is probably the most common one, is lower back pain. So, if someone has lower back pain that they're suffering with fairly regularly, what are some basic things that you would encourage them to consider as they move forward to resolve that or at least reduce the pain they're feeling?
Um, One thing, and this isn't actually something that I do, but obviously you brought it up, and it's one of the things that you help people with. A lot of the times, like if someone is quite a bit overweight, their body, all their joints, everything is just dealing with having to carry around this load that it wasn't really designed for. So, that may literally be the solution. Get moving, lose weight, get the body functioning, strengthen it up a bit. That may actually be the long-term solution. And for a lot of people, those simple sort of things actually are. For people that have tried those things though and done the conventional, I've got a sore lower back, so I've strengthened my core. I've lost some weight, I've strengthened my core, but they're still having issues. They're generally the people that I work with. They've had pain for quite a while. They've tried the conventional things. Um, what I find is lower back pain comes down to there's two things that I will assess. So every time I bring on a new client, I'll do a physical assessment, do it via Zoom. There's usually a few things, but two non-negotiables are their hip mobility, and in particular, how much their leg rotates in their hip. And then the next thing is how does their spine segment? Can they move their spine at the individual vertebrae? One of the, and there are two very specific things. I heard Steffi Cohen, who's she did a master's degree in lower back pain. When she was going to college, she was she's I think she's a 25 times world record holder, power lifter, was going to college, hurt her back, no one could help her. And this was literally the place where people are learning to help people like that. Um, and I heard her on a podcast with Tim Ferriss once say that about 85% of lower back pain, there's actually nothing mechanically wrong with their back. One of the things that happens with our back is if we get a like a perceived problem or a little problem or even a perceived problem by our nervous system will protect us. And it protects us just by seizing the muscles up around that area of the spine where that perceived problem is. What we then do is we get scared, we brace our core, and we stop moving. So we've got a lot of muscles that run up and down our spine that control our vertebrae, the multifidi, loads of muscles in there. But what happens is if we are actively bracing our core and staying still, or staying braced and staying upright all the time, we don't really use those muscles. Um, all of our tissue have little sensors in them that are effectively a communication module that's talking to our nervous system, so our nervous system knows what it's doing at the time, which is why if I close my eyes and move my arm, I know where my arm's going, I know what it's doing. And that's how our body knows, what it's doing, where it is. But like everything else in our body, if we don't use it, we lose it. So if we stop using those tissues that control our vertebrae, those signals stop being sent. Now, this isn't going to happen in a day or a week. It might happen in months or even a few years. But at some stage, there's a whole section of spine of a few vertebrae where that signal has stopped being sent to the nervous system. So the nervous system one day realizes, I don't know what my spine is doing. What the nervous system does as a reaction to that is it tenses up all around the spine because it's like, I don't know what my spine's doing. I better protect it just in case. And then it seizes up. So that's actually a super common reason for back pain is just tightness around the spine because the body doesn't know what it's doing.